This is a huge, huge room, so it doesn't really, it's not maybe so conducive to interaction. So we would like to ask you to come as close as possible to this side of the room. And since you have, you can look at the screen, but you can also look at the small screens. Is everybody here? Shall we start? My name is Sietske Steeneker. I work with UNFPA, the United Nations Population Fund. I'm based here in Brussels, and I'm really, really happy to have been asked to moderate this panel because I think there are two very interesting topics, and the session is called Two Birds, One Stone. The idea of this session is to explore the topics of school-related gender-based violence and comprehensive sexuality education, as well as the linkages between the two from the perspectives of both policy and practice. And in doing so, of course, we want to see how policies and programs in these areas can contribute to both better education and better sexual and reproductive health outcomes, killing two birds with one stone. We first wanted to look at the definitions, but I'm just wondering if this is on the computer or if there's something completely different on the computer. Maartje. We want to look at exactly what we mean when we talk about school-related gender-based violence and what we mean by comprehensive sexuality education. No, it's not the one.
Sorry.
I'll just start reading them. No,
wait. Sorry,
we're getting them.
My mistake. I opened.
That's the one.
Yes, sorry.
The next page.
Yeah, voila. And then there's the thingy, or you can do it
there's
with
no thing, okay.
No, there is.
Okay. Yes, this is what we wanted. School-related gender-based violence. We often use an abbreviation, but we won't in this session because it really is not very good for communication. School-related gender-based violence are acts or threats of sexual, physical, or psychological violence occurring in and around schools, perpetrated as a result of gender norms and stereotypes and enforced by unequal power dynamics. It has many different manifestations of physical, sexual, and or psychological violence, like verbal abuse, bullying, sexual abuse and harassment, coercion and assault, and even rape. And of course, these different forms of gender-based violence overlap and reinforce each other. Then we have, comprehensive sexuality, no. That's the one. Then we have the definition of comprehensive sexuality education. It is a curriculum-based process of teaching and learning about the cognitive, emotional, physical, and social aspects of sexuality. And it aims to equip children and young people with the knowledge, the skills, the attitudes, and the values that will empower them to realize their health, well-being, and dignity, develop respectful social and sexual relationships, and consider how their choices affect their own well-being and that of others, and to understand and ensure the protection of their rights throughout their lives. So both very important issues. Then, why are we having this session? So the organizers, I don't know, should I mention the organizers of the session? Yeah, sorry, I wasn't instructed, but I think it's a good thing. So it's ICRH, the International Center for Reproductive Health, Plan International Belgium, SENSOA, the Flemish Expertise Center for Sexual Health, and VVOB, Education for Development. So those organizers who invited me to moderate came up with this session because until sexual and gender-based violence is eliminated in and around schools across the world, and until children and young people everywhere are able to learn about their bodies, about their sexuality in unbiased ways, many of the very ambitious targets that were set by the global community in these Sustainable Development Goals will not be realized. So we need to understand that these are very basic issues that need to be addressed. It's particularly true if you think about Sustainable Development Goal 3 on health, Sustainable Development Goal 4 on inclusive and equitable education, and Goal 5, of course, on gender equality. So that's the reason why we have this session. Now, I would like to invite Karen de Wilde of Sensoa. I have been discussing with the panelists what her name means. It means Karen the Wild One. So, Karen.
Hi, everybody. The Wild One
Karen,
will
do
talk
your
to
thing.
you. Okay, so let's start. I will walk around here because that makes the session a bit more interactive. What I am going to do is, in fact, more or less impossible because I have been asked to introduce to you the flag system that Sensoa has developed in 20 minutes, while in a normal way we need at least 3 hours. So we'll go in a rush just to have you, let you taste of what it could be. So can Marlies please, the first one. I'll explain in the meantime the colored papers you have got. We will use it because I will ask you questions and you will have to show me your answer by putting up the color that you think is the right one. So please join us. It makes the session a lot more interesting. No? Moeilijk. Oops. Ai. No? Ah, okay. Ça va? I have to wait because I have to show you a drawing before I can ask my question. Maybe I can tell you that we use this system for over 10 years in all kind of settings, schools, institutions. And it has been translated into English in spring this year. So at the end of my presentation, you will get the link to find all the information. If the presentation ever starts. Okay? No, nee. Dat gaat wel niet van mijn tijd af. Oké. Ça va. Nee, nee, is niet erg. Ik zal ondertussen nog even rusten. Wat kan ik nog zeggen? Ik kan veel zeggen, maar ik ga de mensen even laten. Ja, yes, there we are. Sensoa vlaggensysteem or flag system. Okay, we will start immediately with practice. I will show you some situations, drawings, and with children and young persons, and you have to evaluate. Do you think this is completely okay? Then you show the green card. If you think it's not completely okay, then it's yellow. If you are certain that it's not okay, it's red. And if it's absolutely not okay, very severe, then it is black. Okay? Is that clear? Let's start. 3 boys of 13-year-old have shown their penis to some children on the playground. They thought this was very, very funny, but the children are disturbed. What do you think? Green, yellow, red, or black? Show me. I see all kinds of colors, but almost everybody red or black. Has somebody? Ah, I see one yellow and one green, yes. But another yellow, okay. In a normal session, we would take time why you think that color and so on, but today we don't do that, yeah? For obvious reasons. I will give you the right answer later. Okay, next. Two girls, also 13-year-old, are sitting on the bed in the bedroom. They are caressing one another between and over their thighs, and they are enjoying it. What do you think? Green, yellow, red, or black? I see different colors this time. A lot of green, some yellow, and some red. Okay, but the majority seems to think it is green. Okay, we'll explain later. Next. Okay, a 17-year-old boy deliberately puts a naked picture of a girl on internet with the intention to harm her. What color? I see people immediately giving black. Almost everybody or everybody black? Okay, thanks, we'll see later. This one, also one of our classics. A naked boy of 10-year-old pressures a girl of his own age to put his penis in her mouth. What do you think? Green, yellow, red, or black? I see a lot of black, and here and there a red flag. Yeah, okay, it's for me it's interesting because I know a green, even a green, yeah. Okay, next, please. I didn't take many, we could go on for an hour, but we won't. What's the problem if people are confronted with sexual behavior, and especially of young persons, children and adolescents? This always gives emotion. Nobody doesn't react. There's always reaction. And then the discussion starts on values, which is very interesting and important, but we don't have the time today. Why do you think this is okay or not okay? And everybody has a different opinion on sexuality based on your own history and so on. But we also see that discussion in teams, schools, institutions is always personal and emotional. And it's very difficult to come to a conclusion. That's why we have developed our flag system. We try to give a more objective basis to evaluate this behavior. I will in a minute explain. This system is designed to evaluate sexual behavior, more objective. We give you criteria, we give you arguments. We also want to stimulate communication with the young persons with use of common terminology, and we want, and that's very important, we want to normalize their behavior when the behavior is okay, when it's appropriate. Yeah? Green flag is very important. And then we also want people to react in a good way. We give instruments and methods, and we work with this kind of examples as you have seen. Marlies? Yeah. Green flag means the behavior is acceptable, it's positive. Yellow flag means it's a little bit, it's not really abusive. In Dutch, we don't like the word abusive for yellow flag, it's too strong. It means it's just a little bit over the border, over the frontier, over the limits, but not really serious. Red flag means it's troubling behavior, and black flag means it's very severe. Instead of 2 options, okay, not okay, we have 4. Very important, we judge the behavior and not the child or the young person. And green flag and yellow flag are in fact a normal part of development. Green flag is normal behavior, but somebody an idea why also yellow flag is part of the normal development? What do they learn with yellow flags? Yeah? Yes, they learn the borders, the limits. It's when you do yellow flag behavior that people will stop you and say it's not completely okay. So that's the normal development, green and yellow flag. Okay? Yeah. This is a very important slide, but I will go through it very shortly. These are the 6 criteria we use to evaluate behavior. The first question is, did what has happened happen with consent of everybody involved? Was the consent mutual? That's the first question. Second question is, was everybody engaged in this behavior voluntarily? Has nobody been forced? Or social pressure? You don't have to use weapons to force somebody. Third question is, third argument or criterion is everybody who is involved more or less equal? Do they have the same age or in the same age range? When you have two 6 years old and one is a head taller than the other one, they are maybe not completely equal either. So we try to find out, are they equal? How equal are they? And then we will see if the behavior is appropriate for the age or development. And we have developed a kind of tool for that with the name normative list. And we have gathered in this document all kind of findings of international research on sexual development. So it's not because we in SENSOA think it's okay for the age, but it is in fact evidence-based. So this normative list is very important. Next to the question of does this behavior suit or fit the age, is this behavior appropriate for the context? At home, you can do other things than at school. In your bedroom, you can do other things than in your living room. So we will see to the context with a special difficulty, and I put one in it deliberately, the internet, which is a context on its own. But we try to find solutions for that. And the last criterion is self-respect, and that means that the person who starts the behavior, the one who does it, does not harm him or herself by this behavior. What do we mean by that? If you do things that might turn against you, it is not self-respective. I try to find people could be very angry at you. I was looking for the right word. You could get beaten up, things like that. Then it is not self-respective. I am aware that I am going very fast through this because we train this, we explain this, we answer all questions about this, and we take own examples of the group to evaluate. So we really, really train this, but today this is of course not possible. Okay, so the 6 criteria: consent, voluntarily, equality, age or development, context, and self-respect. If all of them are okay, and only then we give a green flag. Once you have a situation that one or more of the criteria is either not okay or not clear, you cannot have a green flag. Then you get another color. And then we help you with some other arguments to evaluate to what extent the limits are crossed. For instance, was it hands-off or hands-on? If somebody touches you or you have to touch somebody, is more severe than when you have to look or hear things that they do or say. Anxiety we also try, and the amount of pressure, what has happened. And a very important argument is what was the intention of the one who did it? To what way he or she could estimate the effects. If they do it on purpose, it's more severe. Yeah? And then another thing important to say is that the color changes of the flag when the behavior is repeated. You can start with a yellow flag, get the right answer, and you get coaching. And if then we think you know where the limits are and you know how to behave properly. And if you repeat your behavior, that means you deliberately cross the limits, and that's more severe. That's why a yellow flag can become a red one if it's repeated, and a red one can become a black one when it's repeated. Can a green flag become a yellow because of being repeated? No. You have listened very good. Okay. We use this steering wheel because it is an image of the 6 criteria, and it also symbolizes the fact that a child or young person stands at the wheel of his or her development. You have also this pictos in the middle that are used to work with children directly. But that's another chapter of the flag system. Okay. Also very important is don't judge too quickly. I have a very beautiful little film to demonstrate that, but you will have to come to one of our trainings to see it. We say, stay as close as possible to the facts, but we don't have to find out the truth. We are not police people. Yeah? But we say stay as close as possible to the facts because we have we always think we know what has happened. We see 2 children, and in our head we know who has started and what has happened. We can be right, but we can be wrong also. So start with asking what has happened. And do that in open questions, not asking, he started, didn't he? Because that's not an open question. You can say yes or no. And it's also, you give the suggestion in your question. That's not okay. Important, don't react out of emotions, projections, values, and so on. Use the criteria. And then, you see I put it in bold, very important. What does this behavior tell us about these children? What are their underlying needs for information, competences, and so on? What do they have to learn? That's my mantra. It always comes back. What do they have to learn? That's the central question of the flag system. Okay, now we will give the answers and you will be surprised every now and then, some of you. Okay, the first one, it will come in stages. First you see, okay, stop. A lot of you gave red, I think because you think this is not at all okay. Some people gave yellow, I don't remember who. If you have heard my very, very brief explanation, what do you think? Is it red or is it yellow? It's one of those 2. Show me. Very old school. Yes, yes, yes. You are right. Show. It is yellow flag. And why is it yellow flag? I know that many people are shocked because they show their penis and we think this is not at all okay. Of course, it is not okay. But this is hands off. They are not being touched. They can be not feel at ease, but they are not afraid. And if they want, they can just turn around and go. They are not pressed to look. So this is not okay, but not very serious. We could have a very interesting discussion on why this is yellow. And not red, but I am very pleased to see that your color that you gave first, with a lot of you changed without much explanation. So, very good class, yeah? Thanks. Next. Okay, the girls on the bed. That's also always a lot of discussion. Somebody asked me one time if I had daughters myself. Yes. What do they are sitting in the bedroom. I think a lot of you the most of you gave yellow. Some gave red. Did this color change after? Or show me what you think now. Yeah. Okay, I still see yellow, but less than the first round. And you feel me coming, it is green. And why is it green? Because the 6 criteria are okay. They do this in mutual consent. They are not being forced. They do it voluntarily. They are equal. This behavior is okay for their age, if you look it up in the normative list. The situation is private. It's okay. And this situation will not harm them later, so self-respect is okay. This is a green flag, but a difficult one. I like to use this one, yeah? Because you have very easy green flags. This is not. Okay? Thanks. Next. Here was almost everybody immediately black. Why did you give black immediately? What made you do this? Do you remember? Kunt het even de tekst projecteren? Okay. Yeah, okay. What did you say? Yes, he did it on purpose because of his intent. He did it to harm her. And this is indeed, you are a very good students. This is the black flag. If you think 4 situations, you know I have to have one example of every flag, of course. So the last one will be the red flag, which is also difficult. Why is this red and not black? What do you think? For us, why do we give this red? What are arguments? Anyone? What do you say? They have the same age. Yeah. If we look at the criteria, of course, she doesn't give consent and it's not voluntarily, but they are equal. They are the same age. Does this fit his age, this behavior? No, not really. He's a bit too young for this. The context is not relevant because we will not say if you do this in your bedroom, it's okay. Yeah? We won't say that. So it's not relevant in this example. And this might also harm him also afterwards because he will get a negative image and all this kind of things. So many things are not okay. But we give red because, and you cannot know because I didn't tell you, this is the first time he does it once. And he's young. So we think in a pedagogical way, we want to help him not to do this again. And that's why we give him a chance. We say the first time is red flag. And also because of the other criteria. They are not all really seriously crossed. But yeah, it could be very interesting to have a discussion on this, but for another time and another place. But this is our standard example of a red flag. But if he does this again, then he gets a black flag. Yes, that's the idea behind the system. Okay. So we also have a way of reaction different for each flag. We always start, I have heard that, I have seen that. We will give words to what has happened. That's the objective of communication. We always say why we react, and then the green flag we can accept, so we can explain why it is okay, or we can ignore. The green flag is the only flag that you are not obliged to react. You can react, but your reaction has to be positive. And that is the most difficult reaction of all. Say that it's okay, and why. So we say you don't have to, you can ignore. Yellow flag, we will limit, explain, provide alternatives. Red, we will forbid, explain, control. And black, we will also forbid, explain, prevent in the future, take measures, consequences, and so on. There are many things I cannot tell you to make it more concrete and why we make these choices. But we don't believe in punishment. Punishment doesn't learn the children what we want them to learn. So we try to work to reconciliation, to mediation, to help them and support them. That's much more important, and that's why it's a pedagogical system. Very important, don't let your emotions guide you. Yeah? You could be right, but you could be wrong also. This is a short overview of our reaction system, which I will not explain. I have said the most important things. And then you can show the next, Marlies. Yeah, 2 minutes for questions. Maybe you can spend 2 hours, but okay, Idas.
I had the impression that the reactions in the room were slightly culturally determined.
Yeah. Which is a very good, very important and very complicated question. Because we tried, do I have 2 minutes to answer? I explained to you the basic system, which we have published 10 years ago, even more than 10 years. Then We have made a new one for children with trauma, children with disabilities, gender sensitive and culturally sensitive. That's what we wanted to do. But at the end, we came to the conclusion that in fact, the system is you can use it in any culture with small adaptations. Hans might tell you more about that because I was in Suriname and worked with his group, and it's working in a completely different culture. So you are right that culture is important, but it's more in the way of reacting, that's very shortly, than in evaluating. The way you talk with, because you need time to do this in a proper way. You cannot start with parents talking about something if you have never mentioned the topic of sexual behavior or sexual development. And you need to give them time, but it's not culture, as we have found out, that is the most important part. So we had the same idea, but turns out that it is important, but not that important.
But the point is that you refer to some normative lists.
Yeah.
How universal are these lists?
Yeah.
Yeah.
That's a very good question. The word normative is maybe not really okay, but because it has norm in it. In fact, it's normal that it refers to. Yes, we are very aware of the fact that this research we have used is, of course, Western. That's true. So there could be differences in what is appropriate for age. Yeah, that's really possible. But that's not our objective within Flanders to make a normative list for the rest of the world. But it could be interesting to see what the differences are, if there are any big differences. That would be very, very interesting. So if you feel interested, shoot. I think the last slide nog een keer. Oh, so I didn't see. Okay, sorry.
Hi, I thought your presentation was excellent. So thank you for that.
Thank you.
But my question is, how do we translate what you're thinking to instruction to the children in schools?
Yeah, we do that. We have we use this as a frame, reference frame for everything we do. So we have all kind of things. Not everything is already completely developed. We are always, how do you say in Dutch? You say voortschrijdend inzicht. How do you translate that? We learn by doing. And so in the years that we have used this, we have had an evolution, enormous evolution ourselves. And we're still doing so. So it's a never-ending story, and we try to find everything we need, and every question, every feedback, critical feedback helps us. So let it come, no problem. But maybe not now, because of your timing. I wanted to show the last, because very important, if you can find it back. Because I'll tell you, the flag system has been translated into English, and it's been published. Yes. Next, please. Questions? Next. Aha. If you want to know more, you can go to the website flagsystem.org, find more information. You can even, I brought my book, or can you show it, Sietske or Marlies? Yeah, a small blue book, The Flag System. So it is now available internationally at last. Okay, I think the next is my email address. If you have questions or want more, the end of my part isn't here, of course. Okay, thanks for your listening, and I'm very aware that it's very short and you have a lot of questions, but you can write them to us. Okay, thanks a lot.
Thank you very much, Karin and Sensoa, for presenting this really interesting and practical tool. I'd never heard of it, but I checked it out yesterday on the website also, and I think it is really a very useful and even fun way of thinking about this. Now it's time to invite our expert panel to the front. Please, Hans, Jona, Joanna, join me. The panel will focus on a central question: how can programs addressing school-related gender-based violence and promoting comprehensive sexuality education contribute to better sexual and reproductive health and education outcomes? We have with us, we'll have with us, I'll start on the left, we have Jona Nestel of Plan International. Welcome, Jona. Jona is an education equity and inclusion champion and programming expert with over 15 years of experience working in global and national contexts. She specializes in gender equality in and through education and advocates for gender transformative education within frameworks like the Sustainable Development Goals. She chairs the United Nations Girls' Education Steering Committee and also sits on the board of the Global Campaign for Education. Then next to me, we have Hans de Greve. Welcome. Hans has been with VVOB, working in Suriname as education advisor since November 2015. Over the years, he has implemented programs on a range of themes relevant for Suriname's lower secondary vocational education system. Recently, a lot of his time and effort has been dedicated to the EU-funded iGrow project on safe and supportive school environments, focusing on sexual and reproductive health and rights and school-related gender-based violence. And previously, Hans also worked with Plan International Belgium. That's this side of the table. Then we have the other side of the table. We have on my far right Joanna Herat of UNESCO's headquarters in Paris, where she provides technical leadership and policy support for education sector responses to improve health and well-being. Her areas of expertise are many, but they include HIV prevention, comprehensive sexuality education, school-related gender-based violence, early and unintended pregnancy, and gender equality. And before joining UNESCO, Joanna worked with the International HIV/AIDS Alliance, supporting community-based HIV interventions in Africa and Asia. Then right next to me, we have Anna Ninsima. Welcome, Anna, who is a lecturer at the School of Women and Gender Studies of Makerere University in Uganda, and at the same time working on her PhD at the Vrije Universiteit Brussels in Belgium. Anna's research interest is in the area of gender, sexuality, and reproductive health, and her aim is, among different aims, one of her aims is getting sexuality education policies implemented and institutionalized in schools with commitment from governments. Welcome, everybody. We're really happy to have such an expert panel with us. Just to kind of, we have just seen Karen's presentation. We were wondering, do you see something like the Sensoa flag system? Do you see it working in your country? And we talked a little bit about the cultural dimension of it. Karen said the cultural dimension is not the most important one. It would be interesting to see. It has been developed and used in Belgium and the Netherlands. It would be interesting to see what you think. Maybe I start with Jona. What do you think?
Well, I think that Karen's an amazing presenter, that's for sure, and she's a hard act to follow. To be honest, when I was preparing for this conference and for this panel, it was the first time that I had heard of the flag system, and I think it's pretty amazing. We haven't used it in Plan's programs, and Plan has programs in over 50 developing countries. But I think what strikes me the most is that the 6 criteria, that's kind of common to good comprehensive sexuality education curriculum, and those criteria are definitely integrated into a lot of the comprehensive sexuality education programs that Plan International implements. The other thing I really like about the flag system is that it takes some of the gray zone out. Sometimes it's hard to tell, is this appropriate behavior? Isn't this appropriate behavior? So it's very it's a nice kind of, matrix system where you can, that's non-judgmental, that's kind of based on kind of, research and kind of the normative framework that Karen described. So it takes kind of the guesswork out of determining whether behavior is appropriate or inappropriate. So I think that's so important for parents and caregivers and teachers. I think it really helps them to care for children better.
Hans, would it work in Suriname? Does it work in Suriname?
Yeah, so we're using it in Suriname right now, actually. So I think probably even today there are trainers, Surinamese people training Surinamese teachers using this system. And so maybe very shortly, why did we opt for this system? Because we have the iGrow project that works with students, with teachers, with parents. But we wanted to give Surinamese teachers some guidance in dealing with sexual behavior of students in and around school. It's something that happens a lot in Suriname. There is a lot of sexual behavior, sometimes appropriate, very often also inappropriate behavior going on in the schools. And teachers, they just don't know how to deal with it. So we try to work on this with this system to address the problem that teachers are having. And I must say, when we decided to work with this system, I was in an acting role in charge in Suriname, and I left some sleep over this, because it was really, I mean, we were really afraid how this was going to be received, because it is not so, it can be quite touchy. I mean, if you look at all the pictures and all the drawings, it is something that my colleagues, my Surinamese colleagues, when we first came up with this, they were like, are you completely crazy? Are we going to do this here in Suriname? So it's scary. It was scary, but I must say that after some time, when we learned to know the system and how it worked, and we talked to a lot of people within Surinamese society, when people get to understand it better, people open up to the system, because and it's a little bit what Jona is also saying, what is really good about it, I think, is it brings a discussion about the behavior of a child or an adolescent back to objective criteria. And you can start discussing about the criteria, and you're not discussing about your own values or emotions that are surrounding the behavior that you have seen. And secondly, what also really works well, especially with educators and teachers, is that it's a pedagogical model. So it focuses on what do we want the student to learn? What do we want this child to learn after today? What do we want him to take with him or with her? And most teachers who have a heart for the students they work with, they sort of are very open to that to that rationale. So that really worked for us. It was scary to start with. It's still scary sometimes. It's not easy. It can get very passionate in the sessions that we are having. There's very often in the beginning there are people who are ready to leave the room and who need to be calmed down, and there will always be people that at the end of the session still say, okay, sorry, but I still don't agree with you, but okay, that's fine, then don't use the system. But in general, I think it was a very positive experience.
Thank you, Hans. Joanna.
Thanks. I love this system. I love the fact that it can be used with children of different ages, and that the response system is just based on, you don't need to talk, you don't need to, discuss what you're seeing as the child. And yet it can open up conversations. I think where I see it as being hugely useful, and I think this is a question that I would ask as well, is the extent to which you see it being modified and adapted for different settings. With the work that we've been doing on school-related gender-based violence, the focus is often on examples of Srgb, and the first question is, do you, in this little tiny case study of 4 lines of whatever it might be, a little bit like your images, do you think this is gender-based violence happening, or what kind of violence is happening, or what rules have been transgressed, and what could be done differently? So a similar approach to using an example. But what's been great is working with young people and in school settings to create those examples. What are the things that are happening? And I think if those images can be adapted and used in different ways in different countries, and the question came up about kind of cultural approaches and different reactions to it, for me it offers such a huge opportunity to be able to do that, to be able to tell a story of difficult things that are happening already, and that young people will be validated by knowing that those stories or their experiences are being discussed.
Thank you. Anna, would it work in Uganda?
I think the criterion is very good because these are the basics for comprehensive sexuality education. But in the context of Uganda, as Hans has explained, I think it can be a little bit difficult. I mean, we have not used it. I have not experienced it. But I really think that the criteria is very good, as long as, for example, the pictures and the examples used suit the cultural context, because there are certain things that, as he said, people may not agree to. So I really think that it depends on how much you explain and how you how those you're training take it. But I think most of the aspects that we see in this flag system are very important and basic to comprehensive sexuality education.
Thank you very much, and thanks again, Karin. A very interesting tool, and that with, as discussed, some adaptations might be have potential to be useful in many different contexts. Now let's get down to the business of the panel. We want to start on the issue of school-related gender-based violence. And I would like to start with Jona. From your experience working with ministries of education and other government stakeholders in developing contexts, what are the main challenges in influencing education policies to address gender-based violence in and around schools, and what challenges? So tell us a little bit.
Yeah, and I'm coming out also from the global level. I'm a global policy and advocacy advisor with Plan International, so I can speak to the national context, but also kind of what's happening at a global and regional level. So I think I'd like to start off by saying that Srgbv, or I'm not supposed to use acronyms, but it's a very, I'll use up a lot of time if I keep on saying, the full term here. But I'd like to start off by saying that Srgbv is a global phenomenon. And while the scale and the scope might be different in different contexts, Srgbv knows no geographical, cultural, social, economic, or ethnic boundaries. So this is a universal issue, which is rooted in gender inequality, unequal power dynamics, and patriarchy, which are, of course, pervasive in all societies. It not only affects students, it affects teachers and school staff as well. Children and teachers can be both victims and perpetrators of Srgbv. And Srgbv impacts girls and boys, gender non-conforming and LGBTQ students and teachers and staff differently. For example, research shows that girls are more likely to experience psychological bullying, cyberbullying, sexual violence, and harassment, while on the other hand, boys often face higher rates of corporal punishment than girls and are expected to take it like a man. It's important to say that today is International Day Against Homophobia, Transphobia, and Biphobia. So it seems even more appropriate to highlight that evidence indicates that LGBTQ students report having experienced bullying or violence on the basis of their sexual orientation or gender identity. In fact, some research shows that 1 in 3 LGBTQ students said that they had missed at least one day of school because they were afraid of violence and bullying because of their sexual orientation or gender identity. The impacts of Srgbv are far-reaching and multifaceted. Siski has kind of indicated there are physical consequences, which include injury, disability, sexually transmitted diseases, included HIV, unwanted pregnancy, and unsafe abortion, and in extreme cases, death. There is impact on the mental health, of course, including depression, anxiety, and suicide. And of course, it impacts the educational outcomes, including absenteeism, poor learning outcomes, and school dropout rates. So in my remaining time, I'd like to talk a little bit more about the policy opportunities and challenges to preventing and eliminating Srgbv that we have identified together actually with some of our global partners who are convened in a global working group called the Global Working Group to End Srgbv, which is actually co-chaired by Joanna and UNESCO, and the United Nations Girls Education Initiative, or UNGAI. So global, regional, and national legal frameworks, policies, and commitments are very important to ensuring governments take action against Srgbv. And in recent years, we've had some strong global and regional commitments to prevent and eliminate Srgbv. So the Incheon Declaration recognizes the importance of gender equality in achieving the right to education and for eliminating all gender-based discrimination and violence in schools. The SDG 4 targets commit us to provide, quote unquote, safe, nonviolent, inclusive, and effective learning environments for all. And just last month, African governments signed up to the Nairobi Declaration on Education, which commits them to make the learning and teaching environment more healthy, inclusive, and safe through adequate responses to school-related violence and discrimination based on gender, disability, origin, race, and ethnicity, and religion. So these global and regional commitments are so important when it comes to national policy and planning. Plan International supports ministries of education in particular to translate these commitments into concrete gender-responsive education sector plans with adequate budgets that are also gender-responsive. Just last week, so before I came to Brussels, I was in Togo for a Global Partnership for Education and United Nations Girls Education Initiative regional training on gender-responsive education sector planning. And all 7 countries that were there identified Srgbv as a major barrier to achieving gender equality in and through education, and that they had to address it through their education sector plans. But from a policy and planning perspective, how can they address it? Well, a critical approach to addressing Srgbv are multi-sectoral partnerships. We touched a little bit about it this morning. Multi-sectoral partnerships is what this conference is really all about. How can education systems work more seamlessly with child protection systems and the health systems and the legal systems to ensure that children and young people not only have a learning environment that's free from Srgbv, but also if they're victims of Srgbv, they have clear referral pathways for reporting violence and accessing counseling and medical services. Another critical investment area from a policy perspective for ensuring effective and evidence-based policy responses are data, research, monitoring, and evaluation systems, but this presents many challenges. As you can imagine, collecting data on Srgbv is difficult for many reasons. Firstly, there isn't a common understanding of what Srgbv is or how it's defined. Secondly, and perhaps most importantly, Srgbv often goes unreported, and this is especially true when social and gender norms make it hard for children to report or recognize certain behaviors and actions as violence. So the flag system would come in very handy to help children understand that certain behaviors are violent and a violation of their rights. The last point on evidence and data that I'd like to make is that places where children and youth are most vulnerable are places where data system and capacity to collect data are usually very weak. But as a global community, I feel like we're making some strides to improve the way we collect and analyze data on Srgbv to inform and influence policy. Lastly, I want to discuss something that has been mentioned a lot today, and that's partnerships. I spoke about multi-sectoral government partnerships, but what we're doing here today, coming together as education and health communities, practitioners and researchers to address some big, deep-rooted challenge, gender inequality, violence, poverty, and how these impact and intersect with education and health is critical. We will achieve so much more if we break down our silos and share our expertise to address some of these challenges. Partnering with teachers and consulting with teachers and teachers' unions is absolutely essential when developing policies and responses to addressing Srgbv. We often think or hear of teachers as perpetrators of school-related gender-based violence, and that's often true. But teachers are critical advocates and can initiate change within the profession. And of course, something that's very important to Plan International is partnerships with young people and children. They're so powerful, and amplifying their voices in policy and planning spaces is part of Plan International's DNA. I want to tell you about a girl that I met recently. Her name is Mazi Dath. She's from Benin. She started a gender equality club in her school to try to combat high rates of Srgbv. And through this club, she and her peers developed a code of conduct that was developed for students and teachers. And students were able to learn about their sexual and reproductive health rights and how to advocate for gender equality. And I'm happy to tell you that Mazi Dath took her message from her school and from her village in Benin to the Global Partnership for Education Replenishment Conference in Dakar, and spoke directly to world leaders about the impact that Srgb has had on her and her community, and urged them to address it. The idea of nothing about us without us, and hearing children's experiences, ideas, and solutions to Srgb is very important. Thanks.
Thank you, Jonna. You emphasized that school-related gender-based violence is universal, so there is really no place on earth that is free of that. It's very much gendered. And LGBTI students experience, we think, more violence, but then again, you also mentioned that a lot of violence in and around schools goes unreported. You also emphasize the need, apart from overall frameworks, the need for concrete gender-responsive policies, and also multisectoralism key to that response, also in the sense that health and education and other referral pathways are available. Hans, you're very well placed to kind of look at both policy and practice. Can you tell us a bit about the challenges and also the factors for success that you encounter in your work in Suriname?
Yes, thank you, Sitske, with pleasure. Yeah, like you said, I'm going to talk to you a little bit about from our practice, from our context. So maybe I will very briefly first sketch this context so you have a little bit of an idea why we are actually implementing this iGrow project and what the iGrow project is all about. And then I can go over some of the main enabling factors and some challenges that we have encountered. Suriname is a small country. It's a big country, but the inhabited places are very limited. It's actually only Paramaribo and a few other cities, and there's only 400,000 people living in Suriname, so it's a very small community. And where we work with in the education system is we work with the lower secondary vocational schools. These are schools where children who have actually dropped out of all other levels of education end up in. A lot of these children, a lot of these students, adolescents, sometimes even almost adults, have experienced many failures within the education system. They are very often highly demotivated. They are very often overage, sometimes very much overage. They can be. We have students who should be in the school, so it's 12 to 16. There are students there who are 21, 22, and there are also students there who are 12 years old. So you have very, very big diversity in ages in the schools. Most of the children in those schools come from very disadvantaged backgrounds. Very often they are broken households with either often a mother, but very often also they live with siblings in the city, or they even live with their boyfriend or girlfriend or with some other distant relative, or probably not even a relative. So men in Suriname are very often absent from child rearing. Many families have children from 3, 4, 5 different fathers. So children, adolescents don't have very good role models if you're looking at a safe and healthy sexual behavior. So it's a very complex situation, and this comes into the schools. And so you see within the the lower secondary vocational schools that we work with, that there is a lot of sexual behavior going on. There are a lot of sexual transgressive behavior going on, and teachers are really having huge problems dealing with it. Which is why, if I talk about school-related gender-based violence, I will be talking mostly about sexual violence, because that is where the iGrow project has wanted to focus on. There is, of course, other forms of school-related gender-based violence. There is bullying, there is fighting going on, there are guns and all that kind of stuff, but it's a little bit less the focus of our program. What we are doing is we are actually doing a school-wide approach to school-related gender-based violence, which means that we work with teachers, we work with students, we work with parents, And we also work with school leaders, but we don't do it alone because it's impossible. I don't think you can find anybody on the earth that can work with those 4 groups in a good way. So we also went for these multi-actor and multi-sectorial partnerships, and we are working together with local Surinamese civil society organizations to work with the students. So that's just to give you some background, so that the enabling factors and the challenges that I'm going to bring up will be maybe a little bit more easy to place into the context. I think when we're working on this school-wide approach to school-related gender-based violence, I think that the first thing that we learned, and the first enabling factor that was very important, is gender is, like Jona also said, gender is so very important when you're talking about school violence. School violence is always gendered. So it's very important, if you're trying to do something about school-related gender-based violence, is that you work on gender, that you work on gender identities, gender norms, and that you make sure that all stakeholders have a very good knowledge. And sometimes we assume that organizations that have already had 3, 4, 5, 6 gender trainings, that they really know what gender actually means. But we found out that in Suriname, you really need to be careful to assume that. We found out that there were a lot of misconceptions about what is gender. Gender is, in Suriname at least, is very often seen as something that is only about women, it's only about girls, it has nothing to do with men, it's a way for women to get more power and to take it away from men, and it leads to a lot of it leads to a lot of discussions and a lot of, I'm looking for the word, weerstand in English, resistance when you're doing these gender trainings. So I think it's very important that before you go into the difficult stuff about how gender influences other aspects like violence, that you get the basics right. That is something that we have learned. And then secondly is you need to go the next step. You can't just have a basic gender training. You need to go into these causal relationships. How does gender affect boys and girls, or how are boys and girls affected by violence differently? How does gender affect boys and girls or affect children in different ways of their lives? And what's really important is you need to have really strong facilitators if you want to do that kind of gender training. And that is something that we also learned, that we had one CSO partner, one civil society organization, who was going to do a gender training for us with students, and they have a lot of experience in sexual reproductive health and rights. They are actually the IPPF representative in Suriname, so we sort of presumed that they would be really well fit to give this training. And what we found out, that as they were used to mostly give trainings, or more like information and communication sessions around safe sex and contraceptives, that they had a lot of trouble to go deeper into the gendered aspects of school-related gender-based violence. And it took a lot of coaching and a lot of working with this civil society organization to actually, these facilitators themselves first need to know where their own values and norms regarding gender are before they can actually go and start to work with students. And it takes a lot more time than we would have thought in the beginning to go to this deeper level. But if you stay on the superficial level, you are not going to get the results that you want. So that is, I think, regarding gender training, it's important to do it, but it's also important to do it right and to take the time and go deep enough into the matter. Secondly, and it's very closely related to it, is that you shouldn't assume that there are certain capacities within the stakeholders you are working with, but you have to check what capacity is there and then build that capacity. And that goes on many different levels. The example I just gave about the level in which your partners can give a gender training is one example that we really found out that we needed to invest a lot more in their capacity to give these gender trainings. But we also had, for instance, we have a program, or part of the program works with school leaders. And so what we do with school leaders is we bring them together in networks, and then we provide them with information, with content, with training around how you can contribute to a safer school environment through different measures. And then the idea would be that these school leaders would then turn that into school policy and then implement the school policy and then monitor it and then learn from that. But what we actually found out when we did this is that there was a problem with the capacity of the school leaders in formulating policy on any level and implementing it and monitoring it. And so what we ended up with was a very frustrating affair, with us giving a lot of input on sexual reproductive health and rights and school-related gender-based violence, and then asking these school leaders to turn it into a policy for their school. And they were like, yeah, but we don't do that. We get our policy from the ministry. The ministry tells us what we have to do in our school. And then so we found out, okay, we need to take a step back. We need to put a lot more work, a lot more coaching into how to actually build this kind of policy. So again, it's important to have a look at what are the capacities, and not only look at what is the capacity in the matter you are talking about, but also what are the necessary conditions, the capacity that needs to be with your stakeholders in order to have a successful program. And I think thirdly, and this is I think very important, if you work on school-related gender-based violence, it's never a neutral affair. You are always going to run into norms, values, rules, regulations on many different levels, on the individual level, on the school level. We use the flag system, but there are a lot of rules in schools in Suriname that children can't hold hands, for instance. But if you can't hold hands in schools, how are you ever going to give a green flag for anything else? So you run into problems at the school level. You run into issues with the education inspection, because the education inspection has a rule that any kind of sexual behavior in the school will have to be reported to the police. But that also conflicts with the flag system. And even the law, so the law in Suriname for the legal age of consent is any kind of sexual relationship between children under the age of 16 is a criminal offense and has to be reported to the police, and the police actually have to act on it, and it has to be sent to a judge, and etc., etc. So you are always, if you're going to work with this kind of system or do anything else, I feel, around school-related gender-based violence, you're going to run into these difficulties, and you need to prepare for that. I mean, it's not the end of the world. You need to prepare for that so that you can build enough support so that your program itself doesn't come into problems, so that you continue to implement your program. That's the first thing. But also, what we have found out is you can also, your program can become a lever. You can leverage a lot of other issues through your program. For instance, the legal age of consent issue I was talking about, because of our program, and we presented our program to a large range of stakeholders, and there was a woman from the police force, and she was throwing black flags around all the time, and we were like, what's up with this lady? Because she was even giving black flags for two children kissing in the schoolyard. And so we had a discussion with her, and then we sort of came out that there were these whole issues around the legal age of consent. But eventually we've had some really good discussions with higher level people within the police force, and the way the police is treating these cases is actually changing because of the discussions we are having with them, because they also see that it's just not very productive to react in such a way to these very, very minor, but maybe, according to the law, criminal offenses. So it's actually a way to change policy on many other different levels, but for that you need to invest in it. You need to build support. You need to find allies, and you can find allies in high places. We have them in the Ministry of Education, but you can also find them in, for instance, in religious groups. One of our trainers, he's a pastor. He's very well respected in the small community of Suriname, and people are looking at him and saying, like, oh, wait, this pastor, he's teaching this, and oh, so it can't be that bad. And the same with certain headmasters. We have a headmaster who is also one of our trainers, and she's known to be a really tough lady on this kind of behavior of students. And she had many students sent off her school, and she sort of changed through the training. And a lot of people are looking at her and saying, okay, she's changed. Maybe we should also think about changing the way we look at this. So find your allies, and then finally, I think what is also very important is, and really worked for us, is always refer to reality. I mean, sexual behavior and sexual transgressive behavior is a reality. Most teachers and educators, they know about it. They just don't know what to do about it. And if you keep on pointing out to that reality, then most people are going to understand that, okay, maybe it's better to deal with the reality than to pretend it doesn't exist.
Thank you very much. I think you gave a very interesting insight in a very challenging environment, vocational schools. You emphasize that you won't get far if you do not address the underlying gender norms. You also stress the importance of capacity building, not only for all kinds of training, but also in formulating and influencing policies, and also influencing policies at a higher level. You were very clear, find your allies, otherwise you can't do much, and also keep the focus on reality, because also your stakeholders know that this is reality. So if you depart from that, hopefully you find your allies in addressing it. So, now let's move to this side of the table. We have talked about school-related gender-based violence. Now we're moving to the other important topic that we're dealing with in this session, comprehensive sexuality education, which, as we saw in the definition, is a curriculum-based process of teaching and learning about the cognitive, emotional, physical, and social aspects of sexuality. And I would like to start with Joanna. Could you tell us a little bit, your work with UNESCO, could you tell us a little bit about the UNESCO guidelines on sexuality education and how they're used, and the lessons that, over the many years that they exist, the lessons that have been learned?
Yep. Thank you. So we're the sex side of the table and there's violence over there, and so hopefully we can bring it all together in a positive and harmonious and non-violent way. That's my daily life at work, bringing those two things together. So I think it's interesting, and I really appreciate you mentioning the guidance. I'm just going to wave it. There we are. It only came out this year. Please do read it if you haven't seen it already. But, I hope you mentioned it because you're on here. There's a huge number of civil society partners that were involved, researchers, teachers, and young people who are involved in the process of revising this guidance, which was revised 7 years after the original version came out. So we fortunately learnt quite a lot during that process of supporting countries to implement sexuality education and supporting advocacy around sexuality education at the international level as well. And so many of those lessons we were able to incorporate, as well as what the evidence was saying. And it's an evidence-informed, rights-based guidance document. So I think there's four things that I want to say about sexuality education and influencing it. And the first thing is partly, I think, building on what Hans was just saying, that this is obviously really complex and really sensitive issues that we're talking about, and very, very challenging. What we have here is an ideal scenario, an ideal set of concepts and learning objectives that a comprehensive program, we would hope, would include. But I don't think there's any single country in the world that would go through this guidance now and say, yes, we tick every single box. Not even, dare I say it, those kind of Northern European countries that are famed and feted for their long-standing sexuality education programs. They're close, probably, but it's aspirational, it's idealistic, but it's something for us to work towards. So I think the first thing is to look at what's already there, and a few of us have said this, and it came up a little bit in Leslie's presentation earlier. I think the idea that every country has a basis for teaching something about biology, something about reproduction, something about skills. Every country is doing that in their education program. So let's start with that as the basis. And so the work that we've done has focused on, we have tools which break down the content that's recommended in the guidance. And we work with the various stakeholders in a country to say, okay, from your teacher training program that already exists, which are the things that are being addressed, what is being dealt with? In your curricula for primary and for secondary, which topics are integrated? Is it in civics? Is it in biology? Is it in music? sexuality education is integrated into music amongst other topics in Sweden, for example. So there's always a basis, there's always somewhere to start, and let's start from that position, and then let's see where the gaps are and what needs to be strengthened. So that would be the first point, and there are tools to help us to do that. The second point is around dialogue and partnerships and stakeholders and community. And in every country that we've worked in, and I think this has been particularly the case in the African countries that we're supporting this work in, you don't move forward without engaging with parents associations, with teachers associations, with religious leaders most particularly. And so bringing in and talking to those groups of people and saying, and that's at the moment of trying to work out what your national policy might be around that might integrate sexuality education. It could be a policy on pregnancy, it could be a policy on school health. But you can't do that without that dialogue. And you absolutely need young people in that space as well to be able to say, these are the issues that we're facing, so that we don't only have one group claiming some kind of greater knowledge about the experiences of young people than any other group. That's also the case during curriculum development, and that's tricky because curriculum development is also quite a specialised process. You know, it's really specially trained and experienced people who have the role and mandate to do that, who understand child development, educational processes, and who will also have a sense overall of where that nation's curriculum is and what it's trying to do and what the objectives are. So you need a broad-based consultation, but it can't just entirely be written by committee. So we have to find a balance in bringing those things together. But again, are young people involved? Is there an awareness of the different kinds of tools and approaches? Would someone know about something like the flag system and say, okay, let's bring some of these aspects in and line some of those concepts and objectives into a curriculum framework. The third thing is teacher training, and I think I mentioned that earlier today, so I won't repeat it too much, but none of this work on gender, on improving skills and values around health, knowledge around health, none of it will be advanced if teachers don't know that they're meant to be teaching it, don't feel comfortable teaching it, and aren't supported to teach it. And I think the thing that I'm always reminded of is that in the majority of the countries in the world, a large proportion of the teaching workforce is, if they're being asked to teach sexuality education, has never had sexuality education. It's a new subject. So they may have learnt about sex, they may have learnt about reproduction, maybe they just learnt about frogs. It's not terribly helpful when you're trying to decide whether or not it's appropriate that you're as a 13-year-old, you're touching the thigh of another 13-year-old girl. You know, learning about frog reproduction doesn't really maybe help so much. So, you know, there's a massive long process, and exactly as you said, that process starts with understanding what your own values are. What do you think? Should young people be having sex, or are you going to be horrified? But, you know, as you said, teachers are hearing these things. They're seeing the flirtations in the classroom. They're seeing relationships happening. They're seeing examples of abuse happening. But how do you deal with it? So that values-based training for teachers that helps them to deal with the subject. And often it's fairly self-selecting. Teachers who want to teach it are motivated to go towards this subject, because if you're not interested in it, you're probably not going to teach it well. I have a daughter, and I asked in her last year of primary school, I asked the teacher at a teacher conference in front of all of the rest of the class if they would be learning about reproduction and or science, and the teacher said, yes, we might study animals. And I said, I live in France where sexuality education isn't mandatory. And I said, will you be learning about reproduction? We may talk about animals again. And I said, and will you be talking about sexuality? Ça ne me passionne pas, madame. I'm not interested in that. And I thought, taken down in front of all the other teachers. But if it doesn't make you feel something, or then you're not going to teach it. There's examples of countries that I could give, but I think I'd rather hand over to hear from country experience. But to some ways that advocacy has worked, some places where there's been back and forwards movement, and some places where there's been some advances in terms of the curriculum content, but perhaps there'll be time for that later.
Thank you very much, Joanna. Message clear. Start with what's there. dialogue is essential, and don't forget about training your teachers. Let's move to Anna now. Anna, could you tell us a little bit about the lessons learned from your experience with promoting sexuality education in Uganda?
Yeah, thank you very much, and thank you, Joanna, for making my life easy, because I was here burning that comprehensive sexuality education is not being accepted in Uganda. But you have mentioned something that makes my life easy, that actually every country has some aspects of sexuality education, but it depends on how much is being given. I'm going to use my experience in Uganda and what has happened so far with comprehensive sexuality education. And I'm going to focus more on the enabling environment, what must be in place for comprehensive sexuality education to make sense. I want to first talk about the policy environment. I really think that for comprehensive sexuality education to make sense, there must be a policy environment which is very supportive and political will. In the case of Uganda, where I come from, there has been a big resistance towards comprehensive sexuality education, mainly as a result of religious and cultural values, which are really fighting against comprehensive sexuality education. And their argument is not that we shouldn't teach sexuality education, but their argument is that we should not teach comprehensive. Now, these are different. In other words, their cause is a cause for abstinence-only education, but not comprehensive. So in other words, the values for comprehensive sexuality education clash with the values that they stand for. Now, when Hans was presenting, he said that whenever they try to make policies at school level, they find problems because the school cannot implement what at the state or what at the government level is not accepting. And that is the same thing that has been happening in Uganda. So when you do not have a policy that runs or that is supportive for the whole country, for this sexuality education to take place in the whole country, and you have, for example, in the case of Uganda, you have different NGOs and different projects doing sexual and reproductive health or doing sexual and reproductive education, then it becomes a scattered issue. It's like every NGO is doing something in different districts, another NGO is doing something in a different district, and therefore you do not have a coherent project or one thing that is going on. And I find that problematic. Why has Uganda refused comprehensive sexuality education? The argument is that comprehensiveness is quite not acceptable in the values of our country. For example, you have had pictures of same-sex relations. There are issues of masturbation, there are issues of abortion, and some of those issues are issues that our people have said no to. And therefore, when you talk of the word comprehensive, it's like you're bringing a bomb to Uganda. So, but anyhow, we still have sexuality education programs going on through NGOs, and also some little bit in the school curriculum, and also in some programs by the government. I wanted to talk more about the environment in terms of the context and how, even if, for example, we had a good quality comprehensive sexuality education in place, how useful would it be in a context like Uganda? And I want to bring out some aspects of the problems normally we have in developing countries. I'm sure you're tired of listening to them. But unless we handle them or unless we tackle them, then our cause cannot be achieved or we cannot have effectiveness. when we are teaching comprehensive sexuality education, we emphasize that young people should be able to access services like health services. They should be able to access, for example, condoms. They should be able to have HIV tests or STI tests. But in the context of Uganda, where I went, for example, for my field work, when you go to health centers where youth-friendly services are supposed to be provided, and you find one health worker surrounded by so many people, including women and the youth and the children, everybody's there. And I remember when I was interviewing this health worker, whether they have special services for young people, she asked me a question. She said, how would you expect me to handle? Do you see the people here? So how would you expect me to handle? And even then, where is the space? So I want to argue that you may not have a youth-friendly service in a poor healthcare system. You cannot have a better quality youth-friendly service in a poor health system. So in other words, we need to look at it holistically. We cannot just say we are going to provide youth-friendly services which are quality and yet the healthcare system is rotten. You cannot say you're going to have a comprehensive sexuality education curriculum well delivered when the education system itself is not okay. So in other words, you need to strengthen the education system, you need to strengthen the healthcare system so that these other aspects of sexual and reproductive health can also be part of it. We also talk about rights, and for example, sexual rights and destiny, and for these young people to be able to define their sexual destiny. And quite often, I mean, when I was in the field and I was interviewing people, and I saw how they were so mad with the legal system, how, for example, the police itself is so corrupt. So in other words, you have nowhere to run to in case of a problem. So there are so many, the environment is so disenabling, I would say. But I also want to talk about gender, the gender inequalities in our societies. And so whenever we are talking about comprehensive sexuality education, we're talking about assertiveness, self-esteem, and issues to do with your rights, really, to know yourself. And normally when I'm talking about gender, I give my own example because I have lived that life. So allow me to tell you a bit about the kind of environment that I grew up in. We are 12 children from one mom, and I follow a boy. And this boy was my playmate, so we were so much friends. But whenever they would ask me to go to cook and he comes along with me, my father would shout at him, or he would say, "You're stupid, how can you go to the kitchen?" So then it would send a message to, it's like, okay. So, but that one was not bad at all. But I'm just telling you what happens. But what would make me sad is that this is my playmate and this is my friend, but when it's a family meeting, he's invited but I'm not, just because I am a girl. And I think that sends a message to me to say that you have nothing to offer. Now, more to that is that because we were 8 girls in my home, my mother was worried that if any of us got pregnant, we would make her ashamed in community. So she took it upon herself to fight our self-esteem, to put us down. So I grew up knowing that I'm nothing, because she would tell me, "Now look at yourself. Who will even ever marry you?" So I never knew that I'm somebody, because and of course I understand what she was up to, but it really killed me, and it killed the rest of my sisters. So that killing of self-esteem, just because somebody doesn't want to be ashamed in the community or whatever she thought, is something that you fight on for the rest of your life. And unless maybe you get an opportunity and somebody to tell you that actually you can do it, that actually you can make it, then it really haunts you for the rest of your life. But what I want to say more is that was not even enough. When I started my periods, I didn't know about sanitary pads. So we used to use cloth, and sometimes this cloth is not just readily available, so you just pick anything, and maybe it's like a sweater-like something. So this is what you're using. And I didn't tell my mother because, we didn't have a relationship. So I told my sister, and my sister got me something to use. But with time, of course, my mother had to know, because where would I get the other cloth to use? But what I want to bring to your attention is that you have this piece of cloth that you're going to wear for the rest of the day when you're going to school. I would walk 5 kilometers going to school. So 2.5 going and 2.5 coming back. But you have this cloth, and when you're walking, it just turns around, you know what? And then, so you are very uncomfortable. And by the end of the day, it burns you. You can't walk properly. It burns you. But that's not even enough. By break time, your dress, your uniform is already soiled. So you cannot go for break. You stay seated. At lunchtime, you have to wait for everybody else to go. And then you tie a sweater around yourself. And whenever everybody sees you tying yourself a sweater, they know that something has happened, and they start bullying you. Now, what did not happen to me, at least, is that a teacher never called to beat me because if I had that sweater on, they would ask me to remove it, and they beat you properly. This is what happens in schools, that you're punished and you cannot have your sweater. But that one never happened to me. I'm sure it can happen to anyone else. But what am I trying to say? Now, you cannot change, because where will you put your cloth when you remove it? In your bag? So you better stay with your thing until you go back home. And when you go back home, you're not walking well because you're uncomfortable. But the first thing you're going to do when you reach home is not to shower, is to do other things, because there's a lot of work. Now, that kills someone's self-esteem. So when you are in class, for example, if the teacher is not trained well, what he talked about, she talked about it. If a teacher is not trained well to give comprehensive sexuality education that is very sensitive, it can even traumatize you. So it is important that we understand the environment we are working in, that we assess the needs of the people we are working with, so that we don't just do programs, but we should understand what people are going through for effectiveness. Because for these programs to be effective, we must understand what the population is going through. In other words, why am I saying all this? I am saying that comprehensive sexuality education can only be effective if we do it concurrently with other aspects. If we deal with other aspects, for example, especially in terms of provisions, the poverty that people are going through is just too traumatizing. That even when you give a comprehensive sexuality education, if you do not deal with those other aspects that I've talked about, it might be counterproductive. But that does not mean that comprehensive sexuality education does not work. Because I know that what you get, the concepts that you learn, for example, respect, the concept of reciprocity, the concepts of knowing yourself and self-esteem, even when you are living in a competitive environment, they have a long impact in your life. And they would be probably better in the next generation. It would still be important in the next generation. Thank you very much.
Thank you, Anna. There's nothing to add to that. This says it all. And also that sexuality education can only be dealt with holistically.
Yeah.
Thank you all for sharing your experience in this round of questions. Now let's focus on specific areas where policy and practice to end school-related gender-based violence, the violence half of the table, and programs to promote comprehensive sexuality education, the sex part of the table, where these two are connected and where they're not. And let's also think a little bit about what this means for moving forward towards better education and better sexual and reproductive health outcomes. And I would like to start with Anna again. I would like to stay with you because what you just described is the underlying gender norms that I would think are related to both topics that we're dealing with. So maybe you would like to start.
Between the gender norms and school-based gender-based violence.
And comprehensive sexuality education as well.
Yes, I believe that education, I really believe that education has the potential to change the mindset of a person. And so it is an important step that we must use comprehensive sexuality education, for example, to change the gender norms that we have. I have already explained a little bit of them, but there are quite a number which also happen in the school. They don't only happen at home, they also happen in the school. Now, the school, which is supposed to be a safe environment, is unfortunately sometimes unsafe, or quite often unsafe. Where you have even the teachers themselves bullying the children, you know? After all, you're a girl. You know, if a girl fails mathematics, then the teacher says, after all, you are a girl. So it's like, it's normal.
It's not expected.
After all, it's expected that you would fail mathematics. So there is a lot of gender-based violence, even in schools, and also the socialization in school, where there is accepted submissiveness, or where the teachers themselves are training children. I mean, in my fieldwork, it was too much for me that even the teachers, the senior woman, we call the senior woman in school, who is supposed to be responsible for sexuality education in school, is the one reinforcing the gender inequalities and teaching girls to be submissive, not to question authority. Now, if you teach a girl that she's not supposed to question authority, how is she supposed to defend herself? Okay? So if you're telling her that because you are a girl, you're supposed to be submissive, and you're supposed to do this and that, and the boy can do that and that, and actually in the schools where we went, we realized that girls are trained that way, but boys are left at large. In other words, it is okay, because the boys, and I mean, if you just leave the boys, if you're not training them to respect, to have respect for the girls, if you're not telling them that actually it is normal for a girl to go into monthly period, if they do not get this information, how are they going to learn to respect? How are they going to have that equality in their relationships? And no wonder most of the sexual experiences of girls are coerced, just because the way they are trained, the way they are socialized, it's just automatic that they are going to be coerced. So there are certain things that education can do. I will still give you an example of my friend who is a graduate and married. She thinks that having sex is not for her, but for her husband. She still thinks like that. She's a graduate. So for her, she has never felt that she can have pleasure. So for her, it is just doing it for someone else. And this is what is happening. I mean, it's even the young girls, whatever is happening to them, it's like they are doing it for someone else. And I think we must change that mindset. That they should also know that they have bodies. They should also know that they can have feelings. And I mean, please check my time.
You're fine.
And of course, that puts them at a very big disadvantage. And that's why, no wonder, most of the relationships are these unequal relationships where money is involved. So it's like a man knows that for him to get a girl, it has to be something to give. And for a girl knows that for her to be in a relationship, somebody must give. And I think there's a problem there. So, I mean, there is no equality. There is nothing like respect. So it's like this superior and inferior. And I think these are some of the things that comprehensive sexuality education can deal with. I am sure, yes, we have talked about the aspects that can stay within you and the certain aspects that you may not take decisions as an individual just because of the society you're in. That there are certain decisions you're going to take. For example, in my case, where I did not have sanitary pads, when I learned that there were sanitary pads in secondary school, I was still using the cloth, but other people had them. So if somebody probably offered 10 euro, I would have probably gotten it, and therefore I would be forced or coerced into sex. And therefore, for that matter, I have not taken a decision as me. It's because the condition has forced me to do that. So there are certain aspects that even when somebody is trained, there are certain conditions that are beyond them, but there are other conditions that they can take decisions about. For example, to decide that I am not going to be put down. For example, I don't want this and I don't want it. Or if I'm approached by somebody, I shouldn't just fold my arms like this or look down. I'm able to tell this person, no, I don't want that. So if girls are trained to be submissive and nice, and then when they are approached or when they are being coerced, they will still do that. So I think that comprehensive sexuality education, that's how it comes in to help our young boys and young girls to be able to understand themselves, to know how they can take decisions, to have certain skills on what they think, or for example, what conditions do you think would, in what condition do you think this, for example, this condition is not right, or such a condition is right. So I think those are some of the things that comprehensive sexuality education can do for us.
I think you made a very, very, very strong case for that. We'll ask the other panelists to talk to this issue as well, and then we have time for questions and answers, because I know that there's people who want to ask questions. Jonna, would you like to comment on this, and maybe also focus on the role of young people themselves?
Yeah, no, I've just had so many aha moments listening to you, and I never considered that comprehensive sexuality education or puberty education or whatever you want to call it can be used for harm rather than good. It can be used to socialize girls to be submissive and to not challenge gender norms. Because in my mind, comprehensive sexuality education does the exact opposite. And I think this is where the SENSOA system and the criteria really come in, because those, when you determine whether, whether a curriculum or whether a program is a comprehensive sexuality education program, you really want to look at, is it promoting gender equality? Is it teaching consent? Is it challenging some of these gender and social norms? This is what makes a comprehensive sexuality education program a comprehensive sexuality education program. If it's doing other things,
different,
then I don't know what kind of program that is. Not a very good one. Yeah, I wanted to talk about young people and how comprehensive sexuality education empowers young people. It can. And the old adage that knowledge is power. And I think what's really powerful about comprehensive sexuality education is the skills and knowledge and the competencies and that it imparts on young people to become advocates and activists that can kind of stand up and resist school-related gender-based violence. We're experiencing this, this phenomenon of having a youth quake, right? Young people are rising up. You see it in the United States against gun violence. You see it all over the world. Young people are powerful. I participated in two very high-level events on education recently. I mentioned before the GPE replenishment, and then last month in Nairobi, the Pan-African Conference on Education. And in both of those instances, Plan had a pre-conference for young people. So we got young people together to develop their own declaration, their own solidarity statement. And in both those instances, young people are demanding comprehensive sexuality education. They want to have access to sexual reproductive health right information. They want to know about gender equality. They want to talk about healthy relationships. They want to build their self-esteem, their self-efficacy. They want the kind of communication skills. You know, these are the kind of skills that, you know, are integrated into comprehensive sexuality education programs that are going to empower young people to be champions of change and to challenge harmful gender norms and to challenge violence and gender-based violence. You know, we have a program at Plan called Champions of Change, where it's actually it's a extracurricular program. So it's not part of the formal school curriculum. It's an after-school club where we have a separate program for girls and a separate program for boys, and then we bring them together after a few sessions. And I think it's important for girls and boys to have their own space to talk about you know, their sexuality and gender equality, and then kind of once they figure it out in their own kind of group, bring them together. But it's amazing what happens with the boys group. It's amazing how boys themselves describe how damaging toxic masculinities are, how damaging the kind of the socialization is on boys, that boys are taught from a very young age that, you know, to be a man means to be violent, to be a man means to be macho, you know, to be a good husband, you know, you need to keep your wife in line. And boys themselves are told, we don't want to be like this. This is not who we are. But we feel the pressure of society, you know, to be this kind of macho guy. So the realizations that boys have through this program, which, you know, I wouldn't call it a full-fledged comprehensive sexuality education program, but it is, you know, has elements of CSC. The realizations that boys have are almost, you know, I wouldn't say they're, you know, they're more, you know, powerful than the realizations that girls have, but it really goes to show how important engaging men and boys is in achieving gender equality and in fighting against gender-based violence.
Thank you very much, Jona. Hans, would you like to comment? Anna already talked about the roles of teachers and that it can be for good and for bad. Maybe you could elaborate a little bit on that.
Yes, thank you. Yes, I mean, for us, it's also very clear that if you want to work around school-related gender-based violence, and developing an understanding within your students of what is a healthy and respectful and non-violent sexual behavior is really important. So CSC is for us is the starting point for any work around school-related gender-based violence. And I think maybe in an ideal world you would want teachers to be the guiding or be the stars in the show. You know, I mean, they should be able to deliver a good, comprehensive sexuality education, and I think they are one of the most important actors in realizing this. But I mean, in different contexts, I think in Suriname anyway, at this moment it's not really feasible to have a comprehensive sexual education package being delivered only by teachers. You would need a curriculum that is approved by the government. There have been some tries in the past to get some kind of a CSE curriculum passed, but a lot of very powerful groups in society sort of stopped those curriculum reforms. And you also teachers need to have the competencies. It's also been said here on the other side of the table. You need to have a teacher who wants to do it and a teacher who is actually able to do it in a good way, because otherwise it can be more harmful than do any good. So what we have done in our program, because it was not feasible at this time to actually have teachers deliver a comprehensive sexuality education program, is that we had a two-pronged approach. So we work with teachers, because teachers are important and they will need to go the next mile, and then maybe hopefully in 10 years, if I go back to Suriname, teachers will be delivering a comprehensive sexuality education package. But what we try to work with them with the flag system, and it doesn't translate well in English, but in Dutch you have a distinction between the pedagogical role of a teacher and the didactical role of a teacher. You know, in class you're teaching, that's your didactics. How are you going to deliver your content to the pupils? But there is also all this attitude that you have as a teacher that is actually directed helping children grow up and becoming into good people and good human beings. So that's their pedagogical role. And I think what we are doing with the flag system is we're really working on this pedagogical role of teachers. We're helping them to support children in developing norms and values that are going to help them later in life. And it's not a comprehensive sexuality education, but I think it's a very important first step. And I think if teachers are able to do this, they might be able to make the next step a little bit easier as well, to actually start teaching on touchy subjects where they now maybe don't feel comfortable. But as it is also important to have this more explicit comprehensive sexuality education, we decided to work with local CSOs, local civil society organizations, Surinamese organizations that have been doing this kind of work for a very long time, but that we try to build their capacity a little bit, that they can do it in a very profound way. And for us, it has worked really well, because at this moment in time, in any case, they have a lot of advantages over working with teachers. One of them is that they can use their own curriculum and they don't need to have it approved by the government. As long as the school director is more or less okay with what these people are delivering and talking about in the schools, then they can just do what they want. They also are a lot more, it's a lot easier for them to find facilitators that fit well with the target group. Your teacher is your teacher, and you have to do it with the person who is in front of the classroom. If you're working with civil society organizations, they can choose facilitators that maybe are a little bit younger, that maybe are more in tune with the context where these children are living in. So for us in the iGrow project, it really worked well to have this double approach where you deliver explicit messages through CSOs, and you work on values and norms and the pedagogical role of teachers through our own programming.
Thank you, Hans. Joanna, we listened a little bit about instances where comprehensive sexuality education can actually work in the same direction as programs addressing gender-based violence in and around schools. Could you elaborate a little bit on that, and perhaps also areas where the commonalities are not there?
Thanks. So I think it's fair to say that there's a huge overlap between work happening on Srgbv and work happening in CSE, but they are not all of CSE is going to address every issue in Srgbv and vice versa. So to me, the principle would be that CSE is this curriculum-based process. It's ideally gender transformative. There need to be a lot of questions around gender roles, everything that Anna said, and I'd just love to leave enormous space for Anna to keep talking about all those things. And I think it's so important that all of that reflection, that reality is integrated. There's content in CSE learning which probably goes way beyond anything that's particularly around gender-based violence. You know, there are some practical and sensible things you really need to learn about actually, you know, how does pregnancy occur? How is HIV transmitted? Or, you know, some of the value stuff around families or so on. Anyway, there's those content areas. And I think with Srgbv, what we see as well is that it's really what we're talking about is a wider holistic approach, because there's also a lot of work that has to happen in Srgbv, which is around the safe school environment. So the policies that need to be in place, infrastructure issues, which might be WASH, might be sex-segregated toilets, and I know that's a very hot topic in the world at the moment, but if you don't even have the option of sex-segregated toilets and you need privacy for all of the reasons, you know, that Anna said and all of the other reasons that people would want privacy. So those things, that's infrastructural issues. What about the reporting systems in school? There have to be effective and trustworthy reporting systems, so that if you do experience violence, you know where you can go, who you can tell, and that that's going to be dealt with. So we have those reporting systems. And then there's all the connections with the services. So if you're looking at sexuality education, we would always talk about needing to pair that with SRH services, and I'm really glad that you made that point. And I think it actually raises an interesting issue about the extent to which you want to create demand for services if they don't exist, although I think CSE goes beyond just demand creation, but it is a very, very important point for us to think about. So there's a lot of SRH services there, and then with the issue of violence, there's different range of services that young people will need. It may be police-related support if there's, you know, if there's rape or systematic harassment happening. It may be child protection, family support services, if the examples of violence, bullying coming from the home and drawing into the household and so on. So there's slightly different services needed, there's slightly different structures, there may be a few more kind of infrastructural issues related to keeping children safe in schools, but a lot of the content and the teaching and learning practice should cover some of the same ground. So there's a lot of area, and I think it's a great opportunity for overlap. Just by way of an example, we've been working for many, many years supporting CSE strengthening in Eastern and Southern Africa, and as we've been talking more about gender and we've started talking more about school-related gender-based violence, ministries and curriculum developers and teacher trainers have said, but practically what can we do? And in fact, we've been able to look at the resources and the ideas developed by partners like Plan and other the systems like the FLAG system and curriculum developed in other regions and places, and said, okay, well, if it's something really practical around positive discipline, avoiding corporal punishment, identifying and recognising gender-based violence, if those are the tools which you feel ill-equipped at the moment with, we can really specifically help strengthen your sexuality education programme by helping bringing those tools and helping those training and learning processes. So we've seen it in that sense as well. The two programmes have continued to complement one another, and I think hopefully they will both end up stronger as a result.
Thank you very much, Joanna. Well, we have learned a lot. We have heard a lot. I'm sure there is also quite a few questions. Let's open the floor for question and answers. We'll take a couple of questions at a time. If you have a question, please also state your name, your affiliation, and if you're more comfortable to speak in Dutch or French, then we can also try and translate. Maybe just start with one and then we'll take a couple.
Hi, Leslie Drake from the Partnership for Child Development, Imperial College London. I thought this panel was inspiring, and where I come from is all about practicalities. So how do we get this into the systems? And one thing I think we should be promoting, and maybe an action point for discussion from this group, is to promote the Disease Control Priorities 3 adolescence package that's actually looking at a framework for secondary education, including sexuality and sexuality education, in terms of where the governments need to go. And they can see that in this framework, and they're looking at it, and they have the budget for it. And the other thing so maybe we should be, supporting governments in translating what that DCP3 message really is. One. The second piece, I think I picked up on the piece on boys. And we've just done a national survey in Nigeria where we're asking the boys what they think about girls. And they're saying, when I say we have money and we have donors to provide sanitary towels for girls, but they don't have any knickers. And so what's the point of having sanitary towels if you don't have any knickers? And the boys are saying to us, well, what do you mean? And so there's a disconnect between what we can produce in terms of sanitary tampons, towels, and what the girls need in terms of knickers, and what the boys understand in terms of why they need knickers. We need to, you need to stick that to the knickers. So there's a lack of education with the boys who really want to understand it, but we're not teaching them that. And the girls, we can give them towels, but we can't give them knickers. So where do we join the dots? And how do we pull the private sector together with the towels, with the knickers, with the education, and make that actually work? Nigeria is actually trying that. And so what we're saying in Nigeria is like, you've got 7 million kids in the school feeding program. For a few pennies more, you could do this bit. And this is the disconnect. So I'm just wondering whether in this an action point from this meeting might be to say, we need to join the dots. The towel guys want to provide the towels, but we need Marks and Sparks, for example, to provide the knickers. And we need to get the health education out to the boys to say, this is what girls go through that you don't understand. And I'm just wondering whether we can make something of this meeting in terms of moving it forward at the country level.
Good point. It's all about the partnerships. Go ahead.
I've got a related question, so I wanted to go ahead and get it on the table now. Following
Sorry,
on what
could you please...
I'm sorry, Brad Strickland. I'm an independent consultant in school health currently at the Global Partnership for Education. I'm thinking of Anna specifically and Joanna when I phrase this question. As a fellow anthropologist, Joanna, where do you situate the role of anthropology, ethnography, local explanations for folk understanding of the body? I think often of rural systems where I've worked in sub-Saharan Africa, and no science grounding per se that actually is taking root in primary schooling, and when people are going home, there's a folk explanation of the body that doesn't jive with what I would think of as somebody who believes in science. I can think of a lot of people in North America who operate on folk understandings of the body that have nothing to do with biology and what we would call real anatomy. So I'm curious how you would situate what sort of roles you see for anthropology, sociology, ethnography in that, if you see one. And I'm just struck by what Leslie is pointing out about boys' understanding of girls' bodies. They very often don't even know what they don't know. They really don't know. It's amazing the things you hear. Boys' understanding of what menses is, and it's amazing. So I'm just wondering, how do you crack that at the ground level to even broach the conversation in the schools or in the Ministry of Education, Curriculum Development Center, communities? It seems like that's a crucial nut that has to be cracked before we make much progress on CSE or gender equality and gender empowerment in RSGBV.
Okay, let's start with these two questions and give the members of the panel an opportunity to respond to them. Maybe start with Joanna?
I'm actually going to take Brad's comment about menstruation and Leslie's comment as well first. I personally feel like there's something of an obsession at the moment with trying to address the issue of menstrual health and menstrual health management by pads, and that it's like this technological solution is going to solve the problem. The issue is one of stigma, of menstruation being kept in the dark, of patriarchy, of inequality, of girls being hidden in shame, in some countries physically having to move out of their houses to live in a hut at the other end of the village and not be able to be touched or be near anybody else. These are the, at the absolute heart of changing social norms and creating societies that are gender equal. Pads aren't alone the answer. There's a webinar happening this week on cups and menstrual cups and how can they be, are they the answer to menstrual hygiene management somewhere in northern Kenya? Well, I'll be honest with you, I struggle to use a menstrual cup in Paris, in my workplace, where there isn't a wash basin next to the toilet. So how the darn hell is a girl in a school in northern Kenya, where I'm assuming the wash facilities are probably fairly basic, is that really where we want to be investing our money? It's probably not the only place we're investing it, but none of the commodities solution isn't the only one, and it's a kind of technological fix to an issue that's much wider. So let's not throw computers at children and pads at children unless we have the systems there to be able to accommodate them. My rant is now over. Puberty. But puberty education is part of sexuality education, and in some places this topic is called so many things in so many different places, and that's great. But it has to be part of it, and boys have to learn about how girls' bodies work, and vice versa. Let's be serious, because that's also can be somewhat awkward if you're not quite sure what's what and where it might go, or what it might do, or what it might not do. So let's get over that. Let's make sure that it's an absolute part of it, and we don't always talk about it as hygiene, which in and of itself would suggest that it's something unhygienic, and that menstruation and puberty is much more than that.
Go ahead, Anna.
I think, Joanna, you did great. I mean, you have answered the question very well. That giving pads may not be the only solution, but it's also not a problem to do that.
No.
And I think when you raise the issue of the knickers, I think the knickers are not so much big of a problem, because it can be used for more than a year or so. But the pads are an every month thing. So I think the issue of pads is more than the knickers. I don't know if I understood the anthropological question very well. I need to be honest with myself.
I don't know if it's an easy answer. My example is very clear. You sit in school and maybe you get a little bit of basic science about human anatomy, and you go home and you're confronted with elders and people who you respect and have to, who have a folk understanding of the body. I can think of cases in North America where it's often analogies to cars and machines. I think of analogies in Africa where I've worked, where people go home and people are saying, oh, it's just like anatomy of an impala. Of course, those are inadequate. We know they're inadequate. And for many people, that's the education reality. They're hearing one thing in the classroom, which is very poorly resourced, and hearing something very different at home from people that they respect.
I would hope that there's a way that of somehow bringing together the narrative. Everyone lives in their own local reality, the community, the norms, the lessons, the stories, and those stories which are such an important part of your upbringing. But there is a fundamental paradox there. If you are learning from your mother that your new baby brother was brought to the house by a stork in the night, and by your teacher that the baby actually came out of your mother's vagina, and your mother doesn't want to use the word vagina, and that causes a problem at school. There is clearly a paradox, and that is an issue. You know, that's one of the reasons why we talk a lot about making sure that parents are on board with sexuality education, particularly the more sensitive things. A letter might go home. At the moment, we're learning about reproduction. Some places, it's being used as an opportunity to talk with those families as well. But it isn't an easy question to answer. But I think the one thing I would say there is that one would hope that or expect that a lot of the teachers in that school and the school community are also, they're part of the local community. There's no, fixed boundary between what's school and what's a local community. So that those stories and that reality and those histories and that understanding may also form part of the teaching narrative, which can be helpful, because one wouldn't want to undermine it, certainly.
Yeah, I really think it's a big paradox, and quite often parents are asking, how much should I say? For example, when a young child of 3 years asks where children come from, then the parents find it very hard. But that's the importance of comprehensive sexuality education, because there is a component of including parents and the community to make sure that they are aware of how much they can tell a 3-year-old and how much they can tell a 10-year-old. But of course, in the context, for example, in our own context, where nobody ever mentions a private part, they have to say it in a certain way. But as she said, it will probably be the same understanding with the teacher at school. Maybe what she calls it at school will probably be similar to what the parent will say at home, but sometimes it's not the same. Sometimes it's completely different, because some parents do not want to talk about it. They just fear to talk about it. Even when the children ask questions, parents tend to shy away from it or send them to someone else. So I think it's a big issue. So
I just would say, in addition to your excellent points, I know I can say with all confidence in anthropology, sociology, there's been a certain marginalization of qualitative research and information, thick description, as Clifford Geertz used to call it, in favor of quantitative data to evaluate these programs and their impact. And I think it's in the IATT, we've had this discussion on and on for HIV prevention. There are many times quality of life cannot be measured in statistics and numbers, and we have to get back to those sorts of really detailed descriptions in order to break these barriers that exist between health and education around sexuality, life and death matters, and things that are really important to us all.
Thank you. I would just like the others to give an opportunity to react. Hans?
Yes, maybe it's not an answer to your question, but I think it's something that's very much linked to it, and that is, I think, the importance of also having parents participate in some kind of way and involve parents in the sexuality education that's happening with their children. And then it's also something that we have done in the iGrow project, and it's actually been very helpful, because a lot of parents themselves, I mean, they learn a lot during these sessions that we have with them, because a lot of parents, they haven't had any sexuality education themselves. And what also is, and I mean, that's maybe to be expected, but what is very interesting is that after we've had a parent meeting, during the student session, students come up to the facilitators and say, yeah, well, and I had this discussion with my mother, and I had this discussion with my father, and that's something that never happened before. They don't have these discussions, but when you bring them together around the same themes in their school with facilitators that they both trust, they take the discussions home with them. And maybe it's still on a very basic level, but I mean, it's a beginning, and people start talking about sex at home as well. And I think that's very important to take that parent involvement in this kind of programs with you.
Yeah, I mean, really quickly, because I think all the panelists have said so much. For me, this is why it's important to start comprehensive sexuality education early, in terms of engaging men and boys and removing the stigma and taboo of menstruation. To give you my own personal example, I have a 4-year-old son, and he found some sanitary pads, and he asked me, "What is this?" And I was totally fine with explaining to him, that once a month I bleed and I use this, and it takes the stigma away. It's just a matter of fact kind of explanation. This is what my body does because I'm a woman, and this is how I manage it. And for him, it was kind of like, oh, okay, that's interesting, right? So, hopefully he's not going to get to the age where he's like 13 and he's like, ew, what's this? Like, and teasing girls about it. He's like, oh, okay, I learned from a young age. This is a normal, a normal function of a female body, and that's just that. So I think this is why I'm such a big advocate for starting comprehensive sexuality education earlier. Of course, appropriate comprehensive sexuality education. You're not teaching 5-year-olds about condom use and stuff like that. You're teaching them about how the body functions. That they have their body belongs to them, and you move from there as they move in stages of their development. But I think starting young is what's really going to address some of the taboos and stigmas that develop later on in life.
Excellent point. Let's open the floor again to see if we have some questions. I see several. You at the very end. Please state your name and affiliation. Yes.
Hello, everybody. I'm Juan. I come from the Viii. Right now, I'm studying in educational sciences as a master student. What you guys shared is really amazing and very meaningful for me, probably for others as well. But I have a question for Anna. As you mentioned earlier, if teachers are not trained well regarding sexuality, this could be a very sensitive problem. But in reality, how can you define a teacher is trained well or not? So do you have specific criteria in terms of this aspect? Thanks.
Thank you for this question. I saw another question somewhere on the same row. Yes, go ahead, please. State your name.
Hello, I'm Dražko Kostovski. I come from IPPF European Network. And it's more of a comment than a question. I just wanted to inform you that we are just publishing an research, an overview of the situation with sexuality education in 25 countries in Europe and Central Asia. And there are some good results. Actually, in most of the countries, more than 20 countries, there is some kind of a policy or a law that enables or recommends comprehensive sexuality education. Also, in 10 of the countries, we can say that there is a comprehensive sexuality education. There is an issue with the opposition. The opposition is getting very strong against sexuality education. And as we already mentioned, the panel already mentioned, there is a strong need for improving the capacities of teachers for sexuality education. But one thing that is very interesting is that in those countries that the curricula is not comprehensive, it's not only that diversity is missing. When I'm saying diversity, I'm referring to sexual orientation and gender identity or teachings on pleasure, but gender is missing. So what Anna told at the panel, it's very important to talk about gender and to strengthen the capacities of teachers to be able to empower young girls and women. Otherwise, we can't talk about STIs. I mean, if we don't explain to young people what is gender equality, we can't go and address other components of sexuality education. Thank you.
Excellent point. More questions. I see someone here.
My name is Anna Dahlman. I work for Dance for Life, an organization working on youth empowerment and SRHR. And my question is mainly for Hans. To start with, I just think that the flag system, I also hadn't heard of it before. And I think it's very, very interesting. I'll definitely look it up more. But I also had a question, as we also work on providing social emotional learning in school settings. And we work mainly with young trainers to actually deliver these sessions, and have found that that can also be a way for students to actually feel comfortable to sharing more of their own experiences and more case studies, what has happened, and then discuss and evaluate that, and of course refer to service providers and those who are really skilled for the more content session. So I was just wondering if you have also considered that with delivering these sessions, or who the actual trainers are. Thank you.
Thank you. Let's take a couple more. I see someone first in the very back, and then you, sir.
Hi, I'm Carmen. I'm a psychology student from Spain, currently studying in KU Leuven University as an Erasmus. And I have a question, it's a general question. Comprehensive sexual education supposedly is not just about sex, but rather providing information about both pregnancy, period, how our bodies work and everything. But it wasn't mentioned in any moment masturbation, which can be considered going way in too deep in the subject, but I think that's very related also to gender inequality, because it's kind of more accepted in men than it is in women. And I wanted to know if that's included in this comprehensive sexual education concept. And also the thing that I think I just forgot. Probably. Okay, I'm gonna leave it at that.
That's absolutely fine. There was another question here. Go ahead, please. Yes.
Nelson Bindarié from Burundi, but I'm living in Grand Duché de Luxembourg. 12 years ago, actually I'm more comfortable in French than English, but trying English because my question goes to Madame Nintsima. 12 years ago, we created a non-profit organization in Luxembourg for education. It's called Éducation Universelle en Afrique. So we are building schools and equipping schools. And I am here to get some ideas to introduce this health issue in schools and nutrition issues too, especially in high school. That it seems to me more complicated. So, Madame Ninsima, at what time did you realize that the situation, the whole situation was really unjust for you girls, for women in your family? When did you realize that? Because your father was saying that and that, he thought, and probably he still thinks it's okay. And as a teacher, are you really teaching the girls to fight against their brothers, their father, their religious authorities? You tell them you have to fight. And do you think you are succeeding in that?
Okay, this is all the questions for now. I think you already asked a question. We give all our panelists the floor to respond to all the questions, and that will be the end of our panel because we need to end in 10 minutes. I would like to start maybe with Hans.
Okay, so let me respond to your question. So it's a question about the peer educators, if I understand correctly, and it's something that is actually, it's part of the program that we have. So we have 3 civil society organizations that work with the students in the schools, and 2 of them work with what you could call peer educators. One of the organizations actually really works with adolescents who were used to giving safe sex education, and that we trained to give them more profound level of gender and comprehensive sexuality education. And then another NGO works with younger facilitators. I mean, I wouldn't call it peer facilitation, but there are people who are 22, 23, and they are much more aligned to what's actually happening within Surinamese youth culture, and they are much more in tune. So I think it's a very, very powerful way of working, and it's something that I think should be considered to be complementary to any kind of comprehensive sexuality education that is delivered through teachers, because they really have a certain advantage that the teacher will, I think, somehow never have. So I think looking at ways to have both would be a good thing. And then there was a question about how to measure the quality of the teaching of comprehensive sexuality education. I'm not going to go into what is good comprehensive sexuality education, because there's people on this panel who are much more experts in that field. But regarding the process, I think what is really important is that you need to involve a lot of stakeholders, and one of the crucial stakeholders is of course the education inspection. At the end of the day, in an education system, it's going to be the inspection who is going to monitor and who is going to be playing the important role of making sure that teachers are teaching the curriculum as it should be taught. And that's easily said, but it's not always as easily done, because the inspection also needs to change their own views and ideas, and so it's really important to take them on board from a very early moment. And the same goes for the teaching institutes, and it goes for the people who are developing the curriculum. But I think inspections are really important.
Jona, any reactions to questions or any final comments on the whole session?
Yeah, maybe I'll react to the question about teacher training and pick up on 2 things that my fellow panelists said during their remarks. The first, Hans said during his presentation that in order for teacher training to be effective, especially when it comes to comprehensive sexuality education and tackling kind of gender equality, is you have to start with the individual. You have to work with teachers and help them understand and realize how them being a gendered individuals actually impacted their life. Until people start going kind of inwards and do some reflection about how gender and gender inequality has impacted them in their own lives from childhood to adulthood, they just won't get it, right? So you have to do that kind of deep work with the teacher as an individual first before you start getting, before you start going into concepts of what's sex versus gender, which is, every day one of every gender training, that's the first session, terminology. What's the difference between sex and gender? We need to scrap that. We need to start with some more kind of individual level work with teachers and addressing teachers as human beings and gendered human beings. The other thing is what Anna, I think Anna made a comment. She was talking about, you can't have youth-friendly services in a poor context, and you can't have effective, comprehensive sexuality education with a rotten education system. I think she used the word rotten, which is very strong. But I agree, and I'm such a big advocate for system levels approach because I see how effective it is. And the work that the Global Partnership for Education does, which focuses really on helping a Ministry of Education and all its partners come around the table to develop an education sector plan and ensuring that that education sector plan is gender responsive, which means that every element of the sector plan, from the teacher training plan to the curriculum, to the facilities, is taking into account gender. Is so critical. So it's not going to be one component of the education system. You're not, just going to invest in teacher training, and some miracle's going to happen in terms of, in terms of promoting gender equality through education. It's really all, all different levels of the system need to be addressed.
Anna, yes.
Thank you, Yona. I think she has answered one of the questions on teacher training. The teachers themselves have to be transformed to be able to deliver a good comprehensive sexuality education, and UNESCO, they have guidelines, and I mean there are so many guidelines that must be used. We have heard from Sensoa, they have the flag system. So basically, I think the materials to use to train the teachers are available. The trainers and the individual teachers, the way they perceive it, that's a different thing. So it depends on the individual teacher, how much they love this and how much are they able to deliver it. But in terms of the materials and in terms of the training, of course, it's up to each country and how much they want to invest in this. Mr. Nelson, I appreciate your question, your tough question. I understand the cultural background into which you come from. And I know that there are certain values that you still hold, and maybe that's the question why you're asking me at what stage did I realize. But in your heart of hearts, maybe you'll be able to understand that there are certain injustices that happen. I must say that whatever story I was giving, it was making me feel bad as a child. But I even got more angry later when I started studying gender. I started asking my question, many questions of why society is treating girls and boys differently, and what impact would this have. So I really call upon you, Nelson, to look at the values that you hold, and you probably still hold now, and see whether what we are doing sometimes, what we call values, yes, they are values, and we like them, and we know maybe there's a reason why those values are there, but I think we need to critically look at what impact will it have on the lifelong of this, on the life of this person, and how much they are able to achieve in life. Or are they able to be what they would want to be? But just because of the conditions we have put them under. So I really think that in your heart of hearts, you're able to think about that. But I do believe that even when we have values, that I also, some of the values I still hold, but I think that there are certain injustices that we cannot continue to accept in our society.
Joanna.
I think I would like not to add anything to what Anna has just said. It was beautiful, so I'd
I completely agree. I think this says it all. I would like to thank everybody for being here. I would like to thank our panel, Jona, Hans, Anna, and Joanna. I would like to thank the organizers of this session and also the organizers of the conference. I thought this was a truly inspiring panel, and thank you all for making it happen.
And please all be welcome for a drink in the room 6 where we have